Okay, so welcome to the ways. So this is course unit 11 for midterm examination, the last topic before your midterm examination. So these are the ways in handling deviant sexual behavior, strategies, and approaches. So what we have discussed last week are those different deviances or sexual deviances, diba? So for this day, we're going to discuss on how to handle them. Yan. Or yung mga strategies and approaches ng mga sexual behavior. So, difference of, let's start with sexual offender and sexual deviance. So, what is the difference between sexual offender and sexual deviance? When I say sexual offender, okay, it is defined as a person that has committed a sexual offense as legally defined by state. Pag sexually offender or sexual offender, ito yung mga tao. Example yan, for example, si Asiko. Yan, sexual offender siya. Ganon. Example lang naman yun, Asiko, hindi ko naman sinasabing sexual offender ka. Yung mga sexual offender, yung mga gumagawa ng mga deviant acts about sexuality. Pervert, yan, maniac, yan, mga maniakis, yung mga nag-rape, yan yung tinatawag nating sexual rapists, yan, yung mga sexual offender. Kapag naman sexual deviance, okay, this is the act, or yung mga dahilan kung bakit sila nagiging sexual offender. So, what is the sexual deviance? So, these are sexually deviant, interest in a non-technical term that states interest in sex-offending behavior and may be defined by specific behavior such as pedophilia but does not imply a sex offense unless the law is broken. So, yung mga sexual deviance, ito yung mga ginagawa mo nga as acts, yung mga pinag-aralan natin na pedophilia, paraphilia, yan, yung mga voyeurism, ayan, ito yung mga sexual deviance. Pero yung taong gumawa nito, ang tawag ay sexual offender. Next. So, what are the factors that contribute to the sexual misconduct? Sa tingin nyo, ano ba yung mga dahilan? Bakit ba nagkakaroon ng sexual misconduct ang isang tao? Ikaw, Asiko, kung mangmamanyak ka, anong dahilan mo? Ha?
Wala, ma'am.
Wala. So, inborn sakit na siya.
Isa lang yan tayong dahilan nun, ma'am.
Okay. So, these are the factors that will contribute to a sexual misconduct. So, several studies have found that victims of abuse are more likely to commit sexual abuse. Yan. Did you watch yung 50 Shades of Grey? 50 Shades of Grey, iba-iba siya, di ba? Ilang part ba yon? 3? 4? I do not know, pero first time ko pinanood yun with Ma'am Jo at tinulugan ko pa siya that day. Sabi niya, panoorin daw namin ulit para maintindihan ko yung story. Kasi at that time, ganyan din yung namin, subject. So, pinanood ko siya.
Uwi na ba si Ma'am?
Yes, pero di ba si doon, si Christian Grey, he is a victim of sexual abuse from her, parang stepmother ba yun? Hindi ko alam kung stepmom niya or talagang mother niya. So, sabi nga nila, several studies have found that victims of abuse are more likely to commit sexual abuse. Yan. Yung mga nabibiktim ng sexual abuse nun, sila din mismo yung gagawa noon. Kaya sila nagkakaroon ng sexual defiance. Kasi bata pa lang sila, naranasan nila yun. So, this is especially the case with individuals and intellectual disability or AID. Kasi parang nagkaroon sila ng diferensya nun kasi yung sa naranasan nila. So, minsan, dahil dun sa naranasan nila, katulad nga nangyari kay Christian Grey, yun ang nag-urge sa kanila para hanapin yung ganung bagay. So, a lack of opportunity to receive education about healthy sexual behavior and healthy sexual identity development has also been seen in many individuals that engage in sexually deviant behavior. Also, one factor din doon is yung walang tamang sex education. Diba? Yung hindi nila alam ang importance. Kaya nga, diba, we have a subject, yung reproductive system, wherein they need to discuss yung ating sexual reproductive system. Kasi, pag hindi nila discuss yan, babastusin nila eh. Even yung bata, hindi curious siya anong kayang gawin ng ari niya. So, maybe, pwedeng magkaroon ng distortions or parang abuse within themselves. So, yun. Kaya nga tinuturo po ang sexual education or sex education. Sometimes, this sex education could be rooted in the school wherein i-discussion ng mga teachers nila in elementary, okay? But also, if you are a parent, okay, it is your responsibility also to open up with that sex education with your anak. Kasi it is really important. Kayo ba girls, kinausap kayo ng mga parents nyo? Doon magdadalaga na kayo, yung mga siguro age ng 9, 10, ganyan. Siyempre, kakausapin kayo ng parents nyo, di ba, about that. And even though, boys, kasi there is a possibility na hindi mo nga alam yan eh. Kasi kailangan talagang i-open yan, both teacher and both parents. Much better if pati parent nyo i-open yan sa inyo para parang explain nila kung gaano ka-sensitive yan. Yung isang bagay na yan. So, in terms of personality, individuals that have engaged in sexually abusive behaviors have often displayed impulsivity and inability to delay sexual gratification. So, yung mga na-expose sa personality naman, yung mga na-expose sa mga manyak, ganyan, or yung parang alam nyo na sa panlitapan na niya, manyak na, or parang sa pag-iisip pa lang niya, manyak na, sabi nga nila. There is, sabi nila, inability to delay sexual gratification, or yung mga hindi makapaghintay. So, studies have also found that most reported individuals engaged in sexual deviancy are males that know their victims. So, most of the time, okay, hindi ko naman sinasabing lahat ng lalaki manyak, pero parang gano'n na nga. So, sabi na sa studies, okay, ito results ng studies to, hindi ko naman po results ng study to. Okay? The study shows that males are prone to these sexual deviances. Diba, halos naman, wala pa naman ako nabalitaan na babae ng rape. Or meron man, kaso madalang na madalang. Pero, lagi, diba, always male ang offender. So, sabi nga niya, most of the studies also found that males are the ones who are offender. And, most of the time, they know their victim. Kilala nila yung mga victim nila. Okay? Siguro tinatarget na niya, kaya kilala niya, di ba? So, treatment and reduction of sexual deviancy. So, paano ba natin magkakaroon ng treatment niyan? Diba? How come paano nila mawawala yung sexual deviancy niyan? So, views of sexuality and sexual behavior shape the form that programs take to treat individuals. The following are some commonly used programs for the identification and treatment of sexually deviant behavior. We have, number 1, sexual education programs. Ayan, di ba? Kaya nga, meron tinuturo yan ng elementary. Ayan, even kapag, alam ba na kayo meron yan. And then, we have also psychotherapy and behavior therapy. Psychotherapy and behavior therapy, it includes cognitive behavioral therapy. It is the individual and the group therapy. So, isa-isahin natin sila. So, sexual education program. So, lack of accurate sexual knowledge contributes to sexually deviant behaviors, and that is especially case among with intellectual disabilities. So, back on this view, it is believed that individuals with lack of knowledge of appropriate sexual and social behavior are more likely to engage in behavior that is sexually deviant as they discover and gain reinforcement from such behavior. So, they are not taught an alternate behavior, appropriate sexual behavior that can replace the sexually defiant behavior. So, kung kasi wala yan, tingnan nyo, bata lang yung teachers niya. Kasi bata pa lang, kailangan, meron na siyang enough sexual education. At the right age, hindi naman ibig sabihin ng sexual education, 2 years old pa lang tuturuan mo na, 5 years old pa lang tuturuan mo na. Tuturo mo yan dun sa tamang edad. For example, 9, 10, ayan, pwede na yan ituro sa kanila. Kasi, yung tipong maiintindihan na nila yung mga bagay-bagay. Yung mga bata kasi, tingnan nyo, kahit nga yung mga, sabihin mo, yung mga batang kalye, have you experienced, tawag dito, encountering them, yung sa mga daan, kahit mga 5 years old, 4 years old, alam na nila yung sex. Or even, they will say bad words or lascivious words about sex kapag, kahit bata lang silang ganun, mga 5 to 4 years old. Bakit po? Kasi they are exposed with the other people, naririnig nila sa matatanda, and sometimes hindi naman nila, ang pangit doon, naririnig lang nila, ganyan, pero hindi nila alam ang meaning. O hindi kasi tinuro sa kanila na mali yun, bastos yun. Yan. So, dahil diba kulang sila sa sexual education programs, that what will happen? They will try to explore by themselves, also, they will use that thing to involve themselves in sexual deviance kasi nga hindi nila alam. Yan, hindi nila alam ang sex ganyan. So for example, sabi niya, an individual does not have access to environment where they can form a social and sexual relationships with peers of a similar functioning level may develop deviant behaviors such as voyeurism or relations with children, as these are only opportunities to engage and receive reinforcement for sexual behavior that their environment provides for them. So, sexual education program covers a wide scope of topics. Programs usually focus on teaching the appropriate social interaction. Ayan. Accurate understanding of physiology and anatomy. Ayan. Age-appropriate relationships. Ayan. Kasi nga po, dapat na sa edad. Human development and sexual health. Different forms of sexual behavior. And the societal and cultural views of sex depending on the program. So, those are different sexual education programs that they can give to those person or to those people na nagkakaroon ng sexually deviant behavior because of the lack of education about that. Kasi if alam mo na yung sex, you have a lot of information about sex, ganyan. Or parang tinuro sa inyo kung paano pangalagaan ng reproductive mo or ano yung mali. There are ways for you to prevent, diba, yourself from keeping those urges na gumawa ka ng sexually deviant behaviors. Yan. So, yung iba, sabi ko nga sa inyo, yung autosexual or masturbate sa mga lalaki, natural yan. Okay? Na gawin nila yan. Kasi, kailangan nilang i-produce or kailangan nilang ilabas yung libido na yun. Ang mali, okay, lalabas nila yon or katulad nung naging issue ni Tekla, hindi ko alam kung totoo kasi hindi man natin nakita. Yung sabi nila, yung mali, gagawin mo yun sa ibang tao. Tignan nyo, kung totoo man yung kay Tekla, okay? Kung totoo man yung kay Tekla and kay Michelle, ang nagkaroon siya ng doon, deprivation, 'di ba? So hindi niya nakukuha yung yung sexual urges niya. What will happen? What will happen to him? Ayan, gagawa siya ng ganon. Lumabas yung pagka-sexually deviant niya. If totoo man yun. No, if totoo man. Hindi ko sinasabing totoo yun. If totoo man. Diba? Next, this theory has not received much support. So, itong sexual education program, most of the time, hindi siya nagkaroon ng support with the other people. Kasi, naisip nila na hindi man enough yun, na kahit turuan mo sila, gagawa at gagawa pa rin sila ng paraan. Kunwari, kung manyak siya, kahit tinuruan mo siya na about sex or ganyan, minsan, hindi man tumatalab yung tuturuan mo siya dun sa proper way. Di ba? Malala sasabihin nila, kahit naman turuan mo siya ng ganyan, kung talagang manyak siya or ganito, lalabas at lalabas yan. So, this theory has not received much support from research as many studies have found that rather than possessing less knowledge, many sexual offenders display greater sexual knowledge than their non-offending counterparts. So, despite the lack of conclusive evidence on the effectiveness of sex education, the format and topics addressed in such programs do have their merits. So, the component of teaching appropriate sexual behavior to participants does provide alternative behaviors that can replace sexual deviancy and allow for individuals to still gain access to sexual gratification. Iba, sexual education programs, pwede rin naman yung one-on-one. For example, yung psychologist, gaganyan nila. Sabi niya, sige, imbis na mang-rape ka, ba't hindi mo na gawin to? Yan. So, sabi nila, minsan hindi rin effective yung mga sexual education programs as yung iba kasing mga offender, kahit alam na yan or alam na yung mga information about that, they still do those sexual deviancy. Next, psychotherapy and behavior therapy. Pag sinabing psychotherapy, we're talking about the psychological aspects of a person. Diba? So, the focus of psychotherapy tends to be helping the person with the pedophilia. What is pedophilia?
Mahilig sa bata.
Manira nga, senior high school ka na. Okay.
Amen.
Sandro.
What is, ano yung psychotherapy or pedophilia? I mean, this is yung mga mahilig sa bata. Okay. The focus of psychotherapy tends to be helping person with pedophilia recognize and combat rationalization about his or her behavior, as well as training the pedophilia sufferer in developing empathy for the victim and in techniques to control their sexual impulses. Yung later lang na parang nag-viral sa FB. Hindi ko sure kung ganun nga ang ano niya, pero nakita ko yung photo, parang nasa shower. Tama ba yun? Hindi ko sure eh. Nakita ko lang sa FB. Blurred kasi yung picture eh. Tapos sabi...
Totoo po yan.
Ha?
Totoo po.
Oh, tama ako. Tama. Kasi Ayoko nang tingnan dahil parang sabi ko, ano ba tong kumakalat na to? And then nakita ko lang parang nasa shower. Ang kita ko, parang parang akala ko pinapaliguan lang niya yung yung mga anak, pero hindi pala. Hindi niya anak 'yon. Hindi niya anak 'yon.
Anak niya po siguro yun, ma'am.
Anak niya. So tas ginanon niya.
Opo.
Sa ibang bansa po yun.
So yun, pwedeng
Sakit na po yun, ma'am.
Oo, pedophilia na yun. Okay? So, psychotherapy can be divided into individual, group, family therapy. So, most commonly, it is a combination of an individual and group therapies. So, several studies have reported that best outcomes in preventing repeated offenses against children occurs when pharmacological agents and psychotherapy are used together. So, pag naman pharmacological, kapag kasi therapy, psycho and behavior, ito yung parang counseling. Okay po, psychotherapy and behavior therapy, ito yung counseling. Dadaanan ka na sa usap-usap, ganyan, psychologist, ayan. Pero kapag pharmacological agents, ito na yung bibigyan kanila ng gamot. So, some studies, okay, or several studies have shown that mas magiging effective sa isang tao na maiwasan yung mga sexual deviance behavior if pagsasabayan din natin yung pharmacological and psychotherapy. Nagkakaroon ng counseling at the same time, binibigyan natin sila ng gamot. So, isa-isahin natin sila. So, cognitive behavioral therapy or the individual. Ito yung individual. Cognitive, pag sinabing cognitive, pag-iisip, diba? Cognitive behavioral therapy is one of the commonly used form of treatment for typically developing individuals that commit sexual offenses. For example, wala kasi akong alam na movie about this na ganito, yung gusto niya sigurong i-prevent yung sarili niya from doing sexual offenses or sexual defiance, they will talk to a psychologist. So, parang isasabihin niya yung mga nararamdaman niya. Pag minsan hindi ko matiis na gusto ko siyang hawakan, ganyan, sabi niya. So, itong cognitive behavioral therapy, it is individual treatment. So, the function of CBT is to replace the undesired covert behaviors with desired behaviors by assessing the individual's perceptions and skill deficits. So, yung iba, siguro yan, nag-consult sila ng psychologist if they think na there is something wrong with their behavior. For example, baka may nakita siyang sexy or kasamahan niya sa work. And then, alam niya, kaibigan naman niya, or alam niya, kinakapatid niya, ganyan. Pero there are times na gusto niyang hawakan yung sexual part ng babae. So, sabi nga niya, yun yung tinatawag nating covert behavior or yung nakatagong behavior niya na bakit ganun siya. Minsan napapatanong siya, bakit ko nagagawa yon or bakit hindi ko mapigilan sarili kong gawin yon. So, naturally, matinong siyang tao, ganyan, tapos minsan bigla nilang lalabas yon na meron pala siyang sexual urges na gano'n. So, ang mangyayari doon, they will consult in a psychologist and therefore, they will ask, So, ang gagawin ng psychologist nun, they will try to understand ano yung covert behavior niya and they will try to convert those covert behaviors into desired behavior. So, this focuses on identifying triggers to sexual behaviors and reshaping cognitive distortion about sexual behavior. So, ano ba kasi nagtitrigger sa kanya? Bakit kapag nakita niya tong babaeng to, gusto niyang gawin yung bagay na yun? Yan. So, sa cognitive behavioral therapy, aalamin nila yung anong cause. Bakit niya nararamdaman yun or bakit niya nagagawa yun every time na makakita siya ng ganito. Di ba may mga ganyan, yung kanwari matino naman sila, pero pag meron silang nakitang isang bagay, biglang lumalabas yung pagka-demonyo nila or parang lumalabas yung pagka-sexually deviant behavior nila. Ayan. So, example, sabi niya, I'm not really cheating on my spouse if I go to a massage parlor. So, and emphasize relapse prevention. So, bakit, hindi naman daw siya nag-cheat, sabi niya, I'm not really cheating on my spouse. Hindi siya nag-cheat sa asawa niya if I go to a massage parlor. Therefore, kung nasa massage parlor siya, hindi siya nakakapag-cheat. So, therefore, that is a prevention. So, siguro, sabi niya, isa sa mga pwede mong gawin para hindi ka makapag-cheat sa asawa mo, is punta ka lagi sa massage parlor. Ayun, di ba? So, siguro, para hindi mo siya hawakan, ganyan, or ma-urge na, or matukso na bastusin yung isang babae, uminom ka na lang ng kape. Ayun. Parang, sa cognitive behavioral therapy, this is one-on-one, this is individual therapy, wherein aalamin nila yung pinaka-general cause or parang ano ba yung nagti-trigger sa kanya para lumabas yung tinatago niya or yung covert behavior na sexual defiant. Ayan. And then, if nalaman nila yung pinaka-trigger or pinaka-reason, then they will provide a solution on how to prevent from coming yung ganong intervention. Parang sa mga couples, kapag diba, there are instances na hindi nila mapigilan na magkaroon sila ng intimate time. So, for example, nag-kiss sila. Pero there is a time na matutokso sila, gagawin na nila yung pang-matanda, yung pang-asawa na. So, there are time na kailangan nilang stop. So, anong gagawin nila para ma-stop yun? Is either yung lalaki, lalabas muna. Diba? Or is either babae, hiwalay muna. Maghihiwalay muna sila. Bakit? Kasi para iniiwasan yung tukso. Parang ganun din doon sa ating cognitive behavioral therapy. Ano ba yung cause? Bakit nag-arouse ka ng ganyan? Kasi ganito na yung ano niya, ganito ganun. So, parang hiiwasan na yan. Ganun ang cognitive behavior. Ano man yung nag-trigger sa'yo, or ano man yung nag-pull out sa'yo, ilabas yung cognitive behavior mo na yun, or yung covert behavior mo na yun, gagawa nila ng paraan para maiwasan, or ma-prevent nila. Maliwanag na ba tayo sa cognitive behavioral therapy? Okay. Next, group therapy. Ayan. So, the goals of the group therapy include ito. So, help the person gain insight and understanding of their individual pathway which led to sexually offending or deviancy. Ayan. So, medyo mahirap to, no? Kasi parang ang hirap naman mag-open ng isang tao about his sexual preferences, diba? With the other people. Unless, natatrust niya yung taong yun. So, develop, implement, and monitor both cognitive and behavioral interventions to recognize and intervene on your specific dynamic risk. So, teach relapse prevention and skills necessary for the offender to reduce and control risk. They help the offender to learn the attitudes, thinking skills, and behaviors necessary to live pro-socially. So, help the offender prepare to use their new skills and knowledge in the community. So, ito group therapy, siguro effective din to if you have a group of friends. Or sometimes, hindi nga siya group of friends, but siguro sa isang institution, ano kasi yun? Hindi ko alam yung title ng movie. Alam niyo yung movie na parang bakla siya? Tapos, ang ginawa niya, pumasok siya sa parang another group sila, group therapy. Tapos, ang nangyari, ayaw na niyang maging bakla, magpapakalalaki na sana siya. Tapos, ang ginawa nila, doon, nagkakaroon ng therapy. Pero, ang lumabas kasi, imbis na ma-therapy siya, lalo lang siya naging bakla. Ganon. Meron, nakalimutan ko yung movie, pero, basta nakalimutan ko yung movie. Ganon yung movie niya. Pinoy movie lang yun. Bakla siya. Tapos pumasok siya doon sa isang grupo para sana itigil na yung pagiging bakla niya. Okay? Kaso ang nangyari, yung palang grupong yun, imbis na itigil na yung pagiging bakla niya, nagiging mas bakla pa pala siya. Yan. So, lumabas lang na lang siya. So, sa group therapy parang ganito. Pwede rin siya na yung papasok kayo sa isang institution, tapos magkakaroon ka ng counseling with the other people. Yan. Then, they will try to comfort you. They will try to understand you. And then, they will give you the advices, kakausapin ka nila anong dapat mong gawin. So, in some persons na siguro hindi hindi nahihiya or hindi natatakot mag-open, effective yung group therapy. Pero kasi most of the individuals that we have known, kapag meron silang sexually deviant behaviors, diba, they tend to secret that one. Diba? They remain secretive kasi nga, tawag ito, very sensitive ang case na yan. Diba? They do even think na parang hindi yan tama, ganyan, or parang nahihiya sila. So, other forms of therapy may helpful as well. For example, family therapy or couples therapy. Yan. Mas maganda siguro yung couples therapy. At least, different couples yung makikita mo. Pero lang kung mag-isa ka, diba? Siyempre, lalo ka lang maiinggit. So, this may restore trust, ayan, minimize the shame or guilt, and establish a healthy sexual relationship between partners. Kaya nga, di ba yung mga mag-asawa, dumadaan ng seminar. Bago sila mag-asawa, di ba? Mag-seminar muna sila. And one of the topic na pag-uusapan nila is yan. Kapag dumaan sila ng seminar, kung paano yung family planning, kung ano yung mga sexually behavior, kailangan pinagbibigyan mo din si Mr., kailangan pinagbibigyan mo din si Mrs. Ganyan. Dadaan yan sa mga, as you go adult, yan. Darating yung time, ikakasal din kayo, ganyan, or mag-aasawa din kayo, pag-uusapan yan. Kasama sa seminar yung ganyan, yung sexually, paano nyo ikikip yung sexually, urges nyo or intimacy within each other. And then, we have pharmacotherapy. Again, pag sinabi natin pharmacotherapy, it is the use of the drug. So, pharmacological treatments are used in order to decrease the general level of arousal. So, SSRI, or selective serotonin reuptake inhibitors. So, SSRI are useful in paraphilias, okay, associated with obsessive-compulsive disorder, impulse control disorder, or depressive disorder. So, some paraphiliacs clearly suffer from inability to resist their sexual urges. Yan. So, which has strong compulsive element and often causes considerable subjective distress. So, theoretically, SSRI may decrease the urges, craving, and preoccupation associated with sexual addiction. So, sa pharmacotherapy, kasi di ba meron tayong different glands that, for example, kung nafe-feel mo yung saya, meron pong dopamine. Ayan, yun ang dahilan kung bakit ka sumasaya. Ang serotonin, kaya mo nararamdaman yan, ito yung ito yung glands na nag-produce para ganito ang maramdaman mo. Sadness, happiness, you want to stay alive, you want to stay awake, or you want to sleep. Merong mga gamot, kaya nga, di ba, may sleeping pills, meron din yung pampagising or mga stimulants. So, sa pharmacotherapy, they will give you a gamot or a drug that will decrease your hormones in releasing or yung mga, sabi nga selective serotonin para mababa or magkaroon ng decrease doon sa mga sexual urges mo. So, magiging effective to para imbis na maramdaman mo yung sexual urge, hindi mo siya mararanasan. Or parang binababa niya or inaalis niya, dineblock niya. Naintindihan niya. For example, overactive yung yung glands mo or yung hormones mo para gumising. So, ang gagawin nila para hindi ka gumising or laging gising or magpuyat, bibigyan ka nila ng sleeping pills. Ganon. So, parang ganito din, para hindi ka laging ganyan, diba, bibigyan ka nila ng gamot para mabawasan or ma-decrease yung urges mo nila. So, that is pharmacotherapy. Kasi, ang ginagawa nila dito is the hormonal treatment. So, this is the treatment that adds, blocks or remove hormones such as androgens and estrogens. Not every sex offender is a candidate for hormonal treatment, even if it has the benefit of being reversible once discontinued. For paraphilias, characterized by intense and frequent deviant sexual desire and arousal, which highly predispose the patient to severe paraphiliac behavior such as pedophilia and serial rapes, a hormonal intervention may be needed. So, most cases of paraphilia are treated with counseling and therapy to help the person modify his or her behavior. Sabi nga natin, di ba, the most effective way on how to stop or prevent a person from doing a sexual deviant acts is to combine or the combination of behavioral psychotherapy or yung counseling na nalalaman natin, and the other one is the pharmacological therapy. So, meron siyang counseling at the same time meron siyang gamot. So, medication may help to decrease, the compulsiveness and associated with the paraphilia and reduce the number of deviant sexual fantasies and behaviors. So, to be most effective, treatment for paraphilia must be provided on the long-term basis, pangmatagalan. So, unwillingness to comply with treatment can hinder its success. It is imperative that people with paraphilias of an illegal nature receive professional help before they harm others or create legal problems for themselves. So, yung iba, naagapan kasi yan, lalo na yung mga mayaman. If ayaw nilang, syempre, masira yung pangalan nila or so whatever, if they think that there is something wrong about their sexual urges, they will talk to a psychologist, ganyan. They will ask for help, ganyan. And then, after seeking for help, the psychologist will advise him or her to have a psychotherapy, ganyan. Parang magkakaroon siya ng counseling. After nun, if nakita niya na hindi effective yung counseling or kahit yung mga pag-usap lang, group or individual man, maybe kailangan na niyang bigyan ng pharmacological therapy wherein they will provide drugs in decreasing this hormones level or hormonal level for sexual urges. After nun, magiging mas effective yung mga pharmacological treatments na yan if they will use that for the very long term. Okay? If in a long-term basis, ginagamot niya yung sarili niya, at the same time, nagkakaroon siya ng psychosocial therapy or the parang group therapy or individual therapy yung with the psychologist or with a group of people. Therefore, nababawasan or nape-prevent na yung mga acts that are sexually deviant. Sabi nga niya, it is imperative that people with paraphilias of an illegal nature receive professional help before they harm others, diba? Or create legal problems for themselves. So, yan. So, kung kayo, magpaisip-isip na kayo, asiko, tanong-tanong na yung sarili mo, baka meron ka ng sexual urges na ganyan, hindi mo pala napipigilan. So, yan. Yan ang mga kailangan mong gawin para gamutin ang sarili.
Sandro. Wala naman akong ganyan, ma'am.
So, do you have any questions before we end this discussion?
Ma'am, tanong ko lang po, yung di ba nga po yung sa pedophilia, yung kay Bossing po, tsaka yung kay Pauline, kahit po matanda na po si Pauline, pero yung agwat nila malayo, maaano po ba na pedophilia yun? Or hindi na? Kasi legal age naman po si Pauline.
You cannot tell us
Di yun pedophilia.
kasi there is a love between them.
Daming pera tawag doon.
Hindi, there is a love between them na. Magkaiba
Sana
kasi.
all my love.
Okay? Magkaiba kasi kapag pedophilia ka, kahit sinong bata titirahin mo. Diba? Pag pedophilia ka. Pero kapag yung kay Pauline and Vic Soto, that's not pedophilia. Kasi there is a love between them. And hindi naman nagkakaroon ng sexual harassment itong si Pauline, diba? So, nasa pag-uusap nila yan. So, hindi ibig sabihin na yung jowa mo mas bata sa'yo ng ilang taon, kay 10 taon man yan, or 30 years old nga. 30 years ba yung kanila? It doesn't mean na pedophilia nila. Ang ibig sabihin ng pedophilia, this is the sexual urges mo along with the kids, kahit sinong kids. At tandaan nyo, kapag meron kayong sexual urges na ganyan, minsan hindi mo man mahal yung taong yun. Or madalas hindi mo mahal yung taong yun, ba't mo ginagawa? Ang nakikita mo sa isang tao na yon is bagay lang sila for your sexual things. They are just things and not person. You do not love them. Okay? You're just using them in order for you to get the sexual gratifications that you need. Okay? So, do you have any questions pa other than that? Good question, Miss Julia. Okay, so stop ko muna to.